One of the most difficult things about recovering from trauma is the feeling that there is a right way to heal. And that if you're still struggling, you must be doing something wrong. The myth here is that many people imagine that healing should follow a predictable path. They expect that with enough effort, enough insight, or enough support, their pain will steadily decrease and eventually disappear. That can happen, but it's not always the case. Emotions rise and fall, memories rise and fall. There are times when we feel stronger and times when we feel overwhelmed again. And when survivors continue to experience fear and grief, shame, anxiety, painful memories, or moments of despair, they often conclude that something must be wrong, that they're not trying hard enough, that they should be further along by now, or that perhaps they're simply not capable of healing. But continuing to experience pain and sometimes having memories and difficult emotions is not evidence that you're doing healing wrong. Healing is rarely a straight line. It unfolds in fits and starts with moments of growth and moments of pain, and sometimes moments that feel like we're moving backward. Continuing to experiencing suffering does not mean that recovery isn't happening. In fact, some of the most important moments in healing occur not when suffering disappears, but when we begin to relate differently to that suffering. When we learn that we can experience pain, we can experience uncertainty, grief, and fear, and still move toward the people, purposes, and experiences that matter most to us. Indeed, in making room for difficult emotions, we also open ourselves to experiencing life more fully, and that includes making room for joy. Perhaps one of the most compassionate truths about trauma recovery is this: struggling doesn't mean you're doing healing wrong. It means you're doing something deeply human while learning how to live with what has happened to you.